And we might as well just get started with all that. I am Mary Barbera. As most of you should know, but maybe with the ethical people, a lot of people don't know because I didn't really get into my exact bio. I was just pretty much interviewing people. But I fell into the autism world in 1999 when my firstborn son, Lucas, was diagnosed with autism one day before his third birthday. I was a master's prepared nurse at that point, a nurse manager, and I had left my job, when I moved and I was 9 months pregnant, assuming that I would go back into the nursing field. But Lucas was diagnosed. Spencer was just 18 months younger, so I had my hands full figuring out what to do and how to get a full ABA program. At the time, back in the late 1990s, it was Lovaas method all the way. I read Let Me Hear Your Voice. I coordinated a home program. I got people to pay for it. And Lucas was not in the best outcome group. He made, a lot of progress. I can't even imagine what his life would be like if he didn't have ABA and I didn't become a behavior analyst. So, ABA is what I've done since 2003 when I was certified as a BCBA. And then I went on to work for the Pennsylvania Verbal Behavior Project, which is the patent autism initiative, right away in 2003 before I was certified up until 2010. So I was elbow to elbow with other behavior analysts, speech pathologists, teachers, paraprofessionals. Then I decided to write my book, The Verbal Behavior Approach, How to Teach Children with Autism and Related Disorders. It's now available in like 10 or 12 languages. It's, I did not expect it to do so well. I just thought I need to get these ideas out in writing. And my goal really is to help parents and professionals. And so I've been I've been a provider of BCBA for a long time and several years and doing it online. So right now, I don't see one-to-one clients. I don't do evaluations anymore. I'm really just focused on just online training to help as many people as possible. My approach, as you can tell, anybody that's done the ethics series, or especially the people that have done the early and intermediate learner course, is I have a very different paradigm, a very different philosophy. And it's combined with all my experience and all the learnings that, everywhere I turned, I learned. But it is really different. So Lynn Sparling is the one who suggested this one-to-one call to discuss the ethics. She got a group of over 20 people, mostly behavior analysts, to join our ethical bundle. So I'm just going to pull Lynn on real quick to say hi. Yes?
Hi, everybody. It's really I'm very excited. I've been looking forward to this for weeks now, Mary, because you and I think we're soul sisters, because I too am a parent of children diagnosed with ASD, and it's all about having to live better, live smarter, and having the child become whose ever child, mine or the people we serve, become more functional. It's about being functional, being able to live the best life that each person can live. And that's the one thing and the only therapy that ABA can do across so many populations. So I'm just excited to be here. So thank you for doing this for us, Mary.
Yes. So I'm going to mute you, but we can get you off.
Okay.
In a couple of minutes. So everyone's now muted, but that doesn't mean I definitely want you to talk, and we're going to have a discussion. So the way I'm thinking that might be easiest is if I'll talk about ethics in general, then I'll talk about the first speaker and Dr. Aileen Schwartz, and then we can have anybody unmute yourself if you don't know how to do that, just type in the chat and we'll help you. And we'll talk about what Eileen said and see if anybody has any input or insights. There are people here who potentially haven't watched the ethical series. So we'll just have to see how that goes. Okay, so, okay, so, and I'm gonna just pull up my screen and share my screen. I want to enable Siri. Okay, so this is the membership site, and we did just have a major redo of our membership site. So if you've seen some changes, it is through the work of our tech person. We did have some technical problems this weekend, so if you experienced any of that, I do apologize. So the ethical series starts out with ethical interview number 1. And I don't know why I am kind of, okay. I'm not sure why I'm not able to scroll up, which I was able to scroll up before, so I don't know what is going on. Anyway, so here are the professional objectives for the whole series and the ethical compliance code. So if you're not familiar with the behavior analyst compliance code, you definitely need to download that. I had the privilege of seeing Dr. Eileen Schwartz present a few years ago at Penn State for 3 hours. And one of the interesting thing is she had us download this compliance code. And then she had us run through scenarios of taking a cup of coffee or a small gift from family, for instance. And she had us run through, like, using her decision matrix, which is under her video. She had us run through, like, what codes would we be using to make the ethical decision. And so it was just, it was really eye-opening, because what I discovered was, well, when we're talking about an ethical issue, these are my big takeaways. When we're talking about an ethical issue, we're not talking about a right and wrong. It's not illegal. It's not illegal. If it's illegal, that's a legal issue. Then we're in a different ballgame. So I think a lot of behavior analysts have this reaction that there is a right, I need to email in and find out the right answer. There is no right answer, because if you are abiding by this part of the compliance code, you might actually be violating this part of the code. So, like, if you have a person who's a nervous wreck and they're from a different culture where, them giving you, like, you not accepting coffee is a complete insult, or a glass of water or something, then you abiding by the no gift compliance code is violating the cultural sensitivity, for example. So there is no right or wrong. And I think Eileen Schwartz's decision matrix is just great. She is writing a book about ethics, which I think is awesome. And so I found her topic. The other thing she said was there is a code. Now, I don't have the codes memorized. I can't tell you where it's at. There's a code that, like, we all should be acting as a behavior analyst first and any other roles second. But Dr. Schwartz said to me, and I think this was kind of off camera, I don't think we captured it, but if I'm a registered nurse, so if she was having heart pain, she would not want me to come in as a behavior analyst first. She'd want me to put my nurse hat on first. And so with my multiple roles, being parent, advocate, nurse, behavior analyst, researcher. It just gets a little tricky to manage those multiple roles. You know, like the compliance code says, avoid multiple roles. Well, that's like my whole life is one big multiple role. So I'm wondering if anybody else has any insight. You can put it in the chat, or you can unmute yourself and just
I'll go ahead. I was a speech therapist before this. So
can you say your name?
this is April.
April. Okay, great.
Yeah. So I feel like that's definitely a multiple role.
Yes. So and you watched the whole ethical series, right?
Yes.
So you're an SLP and BCBA?
I'm an SLPA. I actually transferred out of my master's program into the BCBA program. So.
Oh, okay. Okay. So do you have any thoughts on Dr. Eileen Schwartz's besides that multiple role thing?
No, I felt like that was kind of the part that hit closest to me. I live in a small town too. I live in Oklahoma, where there's only 63 BCBAs in the whole state, and there's only like 15 of us that actually practice.
Yeah.
And so I feel like a lot of people that seek me out, I saw them in speech a few years ago. So I'm really having to look at that type of thing.
Right. Right. And that's, you know, it's really tough because they want to pick your brain about speech, or they want to pick your brain about behavior. And it's like, meanwhile, you're just at the grocery store.
Yeah.
And, you know, it's just constant. Anyone else want to chime in? Okay, so key is, if you haven't downloaded Dr. Schwartz's decision matrix, which I think is great. I don't know if I could pull that up because I was having problems. Let me see if I can pull it up. If you have any other comments about her while I'm doing that, type it in the chat, please. Here we go. Oh, that's a... Okay, yes. Hold on. Yeah, this is really good. So, all right. I'm just going to drag this out. Okay, so this is all Dr. Eileen Schwartz's work, and it basically says, and this is right under her video on the membership site, so you definitely want to download this. I would print it out. I would have a binder, because after 30 days, if you're just with the ethical series, you are going to lose access to everything. So print this out and make sure you watch it. Get your certificate. If you are here with the bundle, you should remain to have access with it. So for anything, whether it's, okay, somebody approaches you at the grocery store and asks you about their child's behavior. Actually, this just happened to me just the other day. Like literally 2 days ago, I'm checking out, and this mom, you know, that I saw her kid years ago, she's like, oh, hi, you know, oh, hi. And I'm like, oh, hi, how are you? And she's like, my daughter's doing horrible. She works here. She's kind of whispering. And I'm like, oh my gosh, you know? So why does this trigger my ethical radar? Well, it's like in public, first of all, and the girl is working there. So, you know, all kinds of things are going through my head. I did basically tell her, because we kind of lost touch. I mean, she asked me if I was still seeing clients, and I told her that I was focusing on online stuff. But I did tell her to search for my name and email me through my website, and I would give her some resources to look at. Brainstorm solutions, evaluate solutions, consider what issues, conflicts, values, tensions might influence each solution, consider client safety, client dignity and self-determination, client outcomes, impact on your relationship with the involved parties, family preferences, have you found an acceptable solution, make a decision, implement it with fidelity, and then reflect upon the results. It just seems like the whole grocery store thing happens to me like almost every day with something. So, it's just kind of, Lynn says, I loved Dr. Schwartz's. Okay. Yeah, I thought hers, I wanted to start out with hers because I had seen her do 3 hours on ethics. And up until that point, I'll tell you, I hadn't been really impressed with some of the ethical lectures that I had seen, like, case scenarios and just treating it like there was a right and there was a wrong thing. And I thought her experience and the fact that she wasn't, the other three people that I interviewed are actually friends of mine. Rose, has taken both my courses, and so, deeply into the VB, verbal behavior world. Megan Miller I'm very close with, and we have similar philosophies, and Amanda Kelly, again, we have similar philosophies. But Eileen Schwartz, I don't really know her personally. I didn't, besides knowing what her stance was on ethics, I really didn't know how much in line she'd be with my thoughts about programming and those sorts of things. But turns out she's very in line, and she does a lot of research with early intervention in the state of Washington.
Well, Mary, I unmuted myself and I finally figured out how to do that. I have to say with Dr. Schwartz, I really identified with her position because I've done a lot of work in early intervention, and I did a lot of work in Trenton, New Jersey, where there's a high, it's a highly diversified population. And there are very many families where, rather poor homes, and you would go in and they really just wanted you to give them validity. They were looking for social validity in their situation. And I really think Dr. Schwartz tapped on that. And that's much more so than for me personally, and I have the deepest regard for Dr. Bailey, but much more than opening up the Bailey and Birch and reading, you can't take a cup of coffee ever, period, for no reason ever. And she just brought that human perspective in. And I think that it's a valid point. If we're going to be working with people on a human behavioral level, we need to be human at appropriate times. So I liked her approach, and that she had it planned out with her matrix on how to arrive to your conclusions, to your own personal conclusions.
Right. And like seeing her for a 3-hour workshop where we were actually working in small groups to go through scenarios and look at, that matrix and look at the code, it's like, whoa, this is really not cut and dry at all. And so, I really appreciated her, and I think she was the perfect start to our series.
I thought so too.
Set the tone. Yeah. Okay, so let's move on to the second interview, which was with Rosemary Griffin, who's an SLP, for about 15 years and then a BCBA for about 5 years. She, reached out to me a year and a half ago and wanted to, start to network with me and those sorts of things. And we hadn't met in person. So I said, the best way to network with me, and this is true for anybody here, is to take my courses, because I really am on a mission, and I have, so much content and so much of my philosophy within my courses that I don't really have time to be getting into discussions and debates and why do I use sign over pecs, or why do I think that, you shouldn't use carrier phrases, or why you think that you need to teach kids to tell you they're in pain, or whatever. I mean, there's just so much that I really limit my interaction for the most part to my group members who are within the Facebook group. I mean, and it's not an annoying Facebook group because we keep everything pretty tight. We have got rules. For those of you that are in the bundle already, you can see that, we also ethically, which we'll get to in mostly in Amanda Kelly's presentation, but ethically, I can't give advice if I don't know the situation. I've never met the child. So, there's that fine line between giving parents enough to do while they wait for a diagnosis, or so that they can question what's going on with their child. Like, for instance, kind of getting off topic here, but we're going to come back to Rose in a second. But Kelsey is our community manager now, but she found my course. She was friends with the BCBA. She was living in British Columbia, Canada. Single mom of 2 boys. Brentley was 2.5, I think, when she found my course. She was driving him an hour each way to an ABA clinic where he was so unsafe. He was running out the door into the street. He was banging his head on hard surfaces around, in every environment, 60 times a day. She had to have him on a leash and a harness. And they're at the ABA clinic trying to teach him colors. He had no mans, no coex, no imitation. Kelsey didn't know what to do, so she joined my course, and she pretty much figured out, like, oh my gosh, like, they're not doing the right thing. And I don't know these people. I'm not trying to bash anybody, but Brentley wasn't getting what he needed. So she pulled him out and she brought him home, and she started teaching him. And so it can work, but we have to give Kelsey the information in the course, not for her specific child, because I don't know Brentley. I've never, evaluated him and those sorts of things. So it's like giving parents, especially parents, enough information that they can really start turning things around and work with other professionals, so that, the 6 hours a day that are at regular school or in preschool or in daycare isn't just like a waste of time, which is happening just so much. So let's get back to Rose. So Rose, having that multiple, like April has, first a speech background and then a behavior analyst background, and Rose also teaches that at community college. And we talked a lot about those multiple roles with Rose. We also talked about speech procedures. I just find that a lot of BCBAs and some speech pathologists just have a knee-jerk reaction to things like talk tools, which is an oral motor strengthening program that everybody that I talk to, except for a couple handfuls that I know, are writing that off as just garbage. And it's not. I don't think it is. I talk in my book in chapter 6 about how I saw progress with Talk Tools. And so people are emailing. I do weekly video blogs. I don't know if you're not on my weekly video blog list and want to, I think you should be. Go to marybarbera.com/join and join our mailing list, and really get into seeing my weekly video blogs. But I do video blogs on all kinds of things like carrier phrases or physical prompting or whatever. And we get emails and comments like, where's your proof? Where's your evidence that we shouldn't teach carrier phrases? It's like, I've worked with hundreds, probably thousands of kids. And so, I can tell you why not to use carrier phrases. It's too early. Or really, I don't use them at all. But, we did talk to Rose about some of those speech issues, and Rose created the Action Builder cards, which are great cards. So we talk about that a little bit. And she's venturing into the social media world and those sorts of things. Lynn said she joined Rose's webmail list, and she was interesting. Does anybody else want to say anything about Rose's interview, or just some of your thoughts on things like carrier phrases, or people's, wanting a research article that's 10 years old with 4 kids in a clinic setting? It's like, I feel like people are, and I think I said this at the ABA conference when we presented in front of like 500 people. There were a ton of people there, which I was so excited about. But I said, I feel like kids are drowning. And I'm like in a rowboat trying to save these kids. And people are like, well, where's your double-blind placebo effect study on the lining of the boat? It's like, you know what? It's not sinking. Like I'm trying to help these people, and you're being so crazy about tit for tat. Like I've done research. I have published research. I published a PhD dissertation, which is available on my website. I published a transfer procedure article that was very big in changing the way kids are taught in 2005. I published an article about the experiences of autism mothers who become behavior analysts with a lot of good insights. And I've done lots and lots, dozens of little studies that aren't published on procedures that I've created. I've done my own studies with Lucas. Like, it doesn't have to be written up and having inter-observer agreement to prove that it works. And I'm trying to get an established researcher, world-renowned researcher, to study my courses.
Well, Mary, can I jump in here? One of the things that what you really brought home to me was something that really prevented me from embracing ABA for so long, was that mentality that, in order to say that something's done, you have to have your a detailed list and your double-blind studies and all those heavy details, which was not what I believe B.F. Skinner was really going for anyway. I think it was kind of like everybody's missing the point here. We're supposed to be making this livable, functional methods of teaching, so not to bog down and prove your own worthiness in the field. And that's what your comments different people have made to you. I totally see where that is. And it also, as someone who runs a group on Facebook, I feel exactly the same way. I had a lot of struggling, especially because I'm not nearly as accomplished as you are, but it prevented me from, for a while, to really double checking, should I really do this? Should I really do this? And now we have enough members who we have some unity. And so I love your goal for 2020, by the way. And just for the balancers in this meeting tonight, Nick Orland still uses your your videos. Like he has your vlog every week, and the balancers know who Nick Orland is. I'm not sure if you do, but he's one of the main leaders in the ABA study group that has 20,000 members. So I think what your point about being communicative, being collaborative, we really do need to work together to make that happen. And let's look at what someone else has to say rather than attack it.
Right.
And I thought that was really spot on.
Right. And we just need to leave our egos at the door,
Yeah.
it's not about I'm right and you're wrong, but at the
Right.
same time, when Lucas, he just turned 22. When he was 2 years old and got early intervention, he got 1 hour of speech. And then, if he would have been diagnosed or closer to, like, I was still in denial, which is a whole nother issue, but kids at that point got 1 hour of speech, 1 hour of OT, 1 hour of teacher. And, if we compare that to kind of the Lobos control group, which is they got whatever was available, like a little bit of this, a little bit of that. But the problem is that without me in early intervention from 2010 to 2016, roughly, with my couple dozen kids that I was able to see and was able to, in some ways, rescue. Like, I mean, I don't even, like, it sounds almost cocky, but it's like they were given 1 hour speech, 1 hour OT, 1 hour teacher. I mean, like, what are we doing? I mean, the same crap is just being offered, and it just breaks my heart. Even if I remove my autism, even as a taxpayer, it's just craziness. So I just want to, that's why I created my third course, which is the toddler course for parents of kids with autism or just showing signs, because I was in denial for a year. I mean, that really is bad. And you have so many people that, are on wait list. The wait list for Lucas was only about 3 months. I've been told the wait list, multiple people have told me the wait lists are at least 9 months. Multiple people have told me 2 years. Can you imagine if your child had cancer, or you thought they had cancer and you had to wait 9 months for an evaluation? I mean, like, what are we doing? So, these topics kind of threaded throughout, but I think we should, in the interest of time, let's move on to the third interview, which was with Dr. Megan Miller. And I met Megan before she had her doctorate, online at first, and then at multiple conferences. She had me come down and speak in Virginia. Very similar philosophy in terms of both of us really don't like the whole escape extinction, the nagging procedure, keeping demand on, for anybody, because it really just is a no-win situation and people get hurt. Lucas had a therapist who moved up to Boston at a renowned, I'm not going to say the name of the school, or I believe it was like a residential placement and a school up in New England somewhere. It may not have been Boston. And they hired her to work with little kids, and they provided room and board and pay, and she'd go up there. And she got up there, and 6 months later, she quit, because when she got up there, they're like, oh, no, you're not going to be with the little kids. You're going to be with the teenagers. And you're going to have to do these stupid procedures. Now, she had been trained, not by me, but she worked it with my son. So, like, there wasn't any bad programming going on. Anyway, she got up to this world-renowned place, and she wasn't a BCBA. She was a worker. She was a paraprofessional or whatever her role was. And she had to keep the demand on with these aggressive teenagers. She had literally bite marks up and down her arms, like scars. And her father, she's just like 25 years old. Her father was like, this is ridiculous, you coming home. but like nobody, when I go into residential placements, I don't know about you guys, if anybody's been, evaluating residential placements and, kids in residential placements that now need an independent evaluation. That never goes well. But, it just breaks my heart because these kids is like, they are just a mess. And then you've got these procedures that are so limiting and they're not, they're focusing on the wrong things and they're taking data on the wrong things. And it's like, we have to do something different. So anyway, Megan Miller talks a lot about the alternatives to escape extinction, which gets into pairing, which gets into demanding, focusing on, having the child participate, be happy. Megan also, she has a couple really great podcasts with Matt Sikoria where she talks a little bit on our ethical series about evidence-based, and evidence-based doesn't mean just or even at all a 10-year-old article with a dissimilar population. So she agrees that evidence-based, definitely a big component of evidence-based is your clinical judgment and your overall, background and how that particular child is reacting. So I think that was a great one. Anybody, so Robin says, I agree, escape extinction point, amen again. Robin, would you like to come online and talk to me? You can unmute yourself if you're comfortable. I'll try to unmute you and see if you're willing. Robin, are you there?
Yes, I'm here.
Are you okay with talking now that I put you on the spot?
I am shy, but I totally agree what you mean about escape extinction and not removing the demand. And I've been in the field doing this 18 years.
Wow.
And yeah, in the beginning, that's what you're supposed to do, hold the demand. And no matter what they're going through, no matter what distress you're putting on that child, you're not supposed to remove the demand. They're supposed to comply to you. And through the years, I was like, that is wrong. Like, and then hearing, some of the videos you've done and stuff, and just my own experience, you don't learn when you're in distress. You're going to learn when you're comfortable, and that's why pairing is so important. And you got to look at the antecedent manipulations to make that child feel comfortable to want to do the demand that later on you'll ask. But yeah, so I've had some experiences with escape extinction, and like, this is the way you do it. Yeah, don't take the demand off, but
yeah,
working with young children, if you put them, and then when they see you again, they don't like you. And I tell my staff, if a child is running from you and not running to you, well, then you need to reevaluate what you're doing.
Yeah.
Because they should be happy to see you. And you got to be able to work out a way to put demands on them without them even knowing you're putting a demand on them.
Definitely. Yeah, I couldn't agree more. And I have never been bitten by a client. And so some people say like, oh, you're just wimpy or whatever. But it's like, I am not,
Right.
It's just a no-win situation. Like, I remember somebody in the BB project was like, I just did a 45-minute escape extinction,
Like, they're proud of it. It's like,
and
that's
I'm like, well, what was the point of that? What's his
Yeah.
BB map? Does the kid's BB map look like?
Uh-huh.
Like, what was the pissing match over, basically?
Right.
And I'm like, what's the BB map look like? She's like, oh, I don't know. I'm like, why would you do that? And she was in a classroom. I'm like,
right.
You're modeling for the teacher a 45-minute escape extinction procedure.
Yep.
That she's supposed to be working with like 3 students during that time. It's like a complete waste of everybody's time. And the bigger the kids get, the more risk injury. And what I found with my son is his SIB and aggression during that pretty much started, late childhood to the teen years. was related to medical problems. And so I was
Wow.
CAT scan and trying to figure it all out. And it's like, so I keep a calendar and I'd say, okay, he had head pain and he had SIB related to head pain, or he was startled, like a fire alarm would ring. If you were near him, he might grab you. If
Right.
we were like swerving to miss a car, like there were a couple like near car accidents that he was in the van or whatever, or the school van, and he would grab the person. It was actually a fight or flight reaction, and he has an autonomic nervous system dysfunction. And now that we have him on a medicine for that, a cardiac medicine, I mean, it's like, I look at these kids that in residential placement, with helmets and bite guards and all this crap, and it's like, first of all, what does their BB map look like? Like,
Right.
Can they talk? Are they potty trained? And then also, I bet medically something is very wrong.
That's true.
And they can't tell you. I mean, at least Lucas can say head hurts or something like that. But, a lot of our kids can't even say that much. So there's just so much to it. But I think the whole discussion about escape extinction is huge. And, it's like, if that's what our field is about,
Yeah,
then
and
it
that's
gives
what-
ABA a bad name. I mean, you have all these self-advocates out there saying ABA is cruel. And in some ways, some people that do ABA, they're not trying to be cruel.
But their approach looks cruel.
Yeah. It looks abusive. And even, I don't think this came up in our series, but in Matt Sikoria's podcast with Megan Miller, I think, she said that, if you try to control kids to the point where you're like telling them to do stuff, even if they don't want to, it could set up for an abusive situation.
Yeah.
Where they can't say no, which I didn't even think about, And the other final thing, which you said, if they're upset, they're not going to learn. And somewhere in my course, I say, like, if you're trying to teach me how to fly a plane and I get in there and I get overwhelmed because
Yes.
there's 1,000 buttons and I am crying and I am like almost hyperventilating.
Yeah, you're not going to know. You're not going to learn.
Like, you're not going to learn anything unless you're in not even just an okay state, but you got to be like, okay, break it down, give me reinforcement. I mean, it's like having escape extinction. It's just like, if you get into a pissing match with a kid, you're not going to win. And they're not going to win either. It's just like
Right.
a situation.
It's a lose-lose situation.
Yeah. Great. Thanks for chiming in. Anybody else want to say anything about Megan Miller's? Okay.
Hey, Mary, this is Kara. I'm
Yes.
just talking as a parent. I just wanted to comment on that for everybody too. As a parent of kids with autism, I remember being in that situation with the behavior analyst before and being guided through keeping the demand on one of my children for 45 minutes. And I remember as a parent afterwards kind of feeling hopeless, and everyone else was feeling very happy that I did it and I got through it. And I remember crying through the whole experience and afterwards thinking, what am I doing to my kids? I was, trying to run home ABA programs with them and trying to help them learn. And I felt like, listening to the ethical interview series and thinking about that situation for me, it made me think about the dignity for my child, how I really took their dignity away by being in that situation and nothing was accomplished. And that hurt for a really long time. So from the parent perspective, I think it's easy for a behavior analyst to guide you through, a procedure that maybe everyone knows. It's not so easy to, help parents learn how to help their kids, how to teach your kids, and how to learn how to do it myself, because as you and everyone here knows, you're with your kids all the time as a parent, and you need to know how to give the right intervention. So I really just think about the dignity that it takes away from the child by being in that situation, and how much extra work it takes to repair that after a situation like that happens. So I never did that again after that.
Yeah. Yeah.
Well, when you think about it, it's really just the same thing as spanking. It's the same exact argument of spanking. You know, we don't spank because you don't want to not only teach violence, but that you're taking away that dignity from a person and exerting power. It's all about the power of the person who's spanking. So, and in the olden days, you know, in my early days with my daughter, like I was told, and I was also told because girls don't get autism at the time. You know, that it was a disciplinary thing or that I had to, you know, exert control over her. And it was the same, this was the same exact thing, whether it's spanking or whether it's restraining a child in a classroom. I remember feeling it is the same exact thing, period. It's just about my exerting control over that child, you know. So, and because originally, as Mary knows, in Pennsylvania, that is what you know, you held your foot to the ground until, that's how I was taught originally. You hold your foot to the ground until they comply. You know, if it takes an hour, it takes an hour. So, I'm glad it's not like that anymore, but that's how I was taught originally.
And I
So,
think a lot of the big institutions with huge infrastructures, you know, the residential placements,
mhm.
the approved private schools, the day programs that are steeped in research and steeped in um, layers, and you know, there's a lot of older BCBAs. I mean, I'm in my 50s, you know, like I'm getting up there too. I should really watch what I'm saying, but you know, some of the older BCBAs who aren't into a verbal behavior approach, who've been trained to keep the demand on. I mean, I think that's just it's just shuffling right through the layers, and I don't know if anybody on the call works at an institution where, you know, you're expected to do escape extinction and that sort of thing. But, you know, and then you get into a um, really tricky situation. Like I know I could never work anywhere. You know, actually I was interviewed one time, it was years ago, probably 8 years ago or so, by Ted Hauk from the where does he teach? Virginia somewhere. George Mason, maybe? I don't know. Anyways, he interviewed me for one of his classes. And he said, it wasn't about ethics, but, you know, he interviewed me and then he said, what was your biggest ethical situation? Or what do you see most frequently or something like that? And I remember like thinking about it and thinking like, you know, when I go into places for the first time, like schools, it's usually pretty bad. And it's almost like reportable. That's how bad it is.
Right.
And so, you know, like the amount of physical prompting, which is really restrained, although people don't know it, you know, and the kind of procedures that are in place by someone, you know, it's bad. It's either neglect or it's abuse or, you know, it's very borderline. But like I'm there and somebody's paying me to be there to help them. You know what I mean? To fix it.
Right.
So it's like that, or that fine line between like you're supposed to be watching Tommy and now like what's going on out of the corner of your eye looks dicey, to put it nicely, you know, and it's like you kind of have to like pair yourself with the staff and not be like, what are you doing? This is like almost reportable, and to the point where you got to get progress quick enough to turn it around so that you can stay and don't have to report it, you know. And it's like that's kind of what I see when I go to new places. But you know, anybody trained like in my approach that has taken all my courses and stuff, I mean, there's just no way that one of our members could go into a situation and be like cool with it, you know?
Well, when I first started my graduate work, I did research on abuse because my master's was in developmental disabilities and across across the lifespan, and the first research project I took on was really truly like a would have been a doctorate dissertation. Truly, it was about the abuses that the the abuse, the physical and sexual abuse of people with developmental disabilities, and the likelihood of their being vulnerable. And the results were that it was more dangerous to be in a back alley in Camden, New Jersey without a gun than living in an institution in New Jersey. Like that was some of the reporting that I came across. And, even if I think that oftentimes, these procedures were started in a really good place. The intention was good. It's not that the intention was bad. Compliance is great when it works and when it's natural. But I think that's what happens. And like many things in life, they take a turn. And I think that in our field especially, there's just no room for that kind of mistake.
Mm-hmm.
There's just no
Yeah.
room for that kind of mistake.
It just gives ABA just a bad rap, and as it should. And now, I find that with parents of young kids, they're not necessarily running towards ABA. They're running towards biomedical treatment, much more so in a positive way. And then, you have a lot of behavior analysts saying it's unethical to work with somebody that's doing, X, Y, or Z, chelation, hyperbaric, whatever.
Mm-hmm.
And I'm not saying that those procedures are all swell for everybody. They're certainly not, and they need to be, looked at. But I think parents are confused, and they're going with where there's hope, where there's a chance of recovery. And like that's what got me into the ABA field was Catherine Maurice's book with Let Me Hear Your Voice, with her kids recovering. And it's like,
Mm-hmm.
there's even it's just like everything is so controversial in the autism field. Like even if I do a blog on recovery, if I do a blog on physical prompting, and a lot of people that are commenting rudely and that I end up having to block are actually adults with autism who are self-advocates, who say they were traumatized by ABA, say that people should just be a little bit different. We're not talking about kids that are a little different. We're talking about kids with major, severe, moderate, severe autism. And,
Right.
We're not talking like I don't even get into the debate with them. It's like, I'm not talking about kids that are a little different here.
Right.
I'm talking about kids with major issues. So, all right. So let's move on to talking about our last speaker, which is Amanda Kelly, Behavior Babe. And she's a good friend of mine. She actually did her dissertation probably a handful of years ago. I think it was 5 years ago. And she did her dissertation on pairing, pre-session pairing. And I didn't even realize, I wrote my whole chapter 4 of my book on pairing. Pairing is a part of verbal behavior. It's not a part of necessarily the Lovas therapy, although I had an excellent consultant with the Lovas replication site, and I had great therapists work with Lucas for years straight, and we did a lot of reinforcement, and it was a good program. Verbal behavior would have been better, but verbal behavior really was in its infancy when I found it. I actually found verbal behavior when my friend flew down to Florida to hear Carbone speak, and when she came back, she told us we had to switch. We were sharing some therapists. My consultant was leaving at the time. And so we got a verbal behavior consultant who didn't really do that great of a job, but I started following Carbone and Sundberg and found my way to the Verbal Behavior Project. But anyway, pairing, I didn't realize there really isn't a lot of research on the topic of pairing. Of course, there is in terms of reinforcement and those sorts of things. So Amanda and I have been friends for several years online, and she's come to a couple of my workshops when I've presented at ABAI. She's really interested in me going to Hawaii at some point again. I've been there like 3 times, but she's great in terms of like her social media presence. She is Behavior Babe on the internet, and she gets a lot of backlash for that too, you know. There's just backlash, it seems like, everywhere you turn, from established professionals who are well known to adults with autism to people who, you know, there just seems to be a lot of infighting in the autism world. So Amanda wrote an article called Blurred Lines with a couple of colleagues. I think Megan Miller might be on that paper. That's right under her workshop page, or her interview. So I really love talking to Amanda. Does anybody have any comments about Amanda?
Well, Mary, you know that I do. With every cohort, I tell each group to always look at Amanda's website and to use her as a reference, because a lot of the things that she has on her main page are very key issues that are obviously on the exam that you have to absolutely know. And she has a great way of describing them. And then the data sheets that she provides, I think, are really are pretty cool. And so someone came on our group not that long ago, and I have said I've been a groupie, long distance fan of hers for such a long time. So I really liked everything that she had to say. So yeah. I was thrilled with her. Is she as cool offline as she seems to be online?
She is actually even cooler offline.
I thought so.
She's really fun to hang out with, and a very nice person, and really wants to turn things around too. So she's awesome. I see Kathy Schubert is here. I'm going to unmute you, Kathy. Hopefully I can. Kathy, hi.
Hi, can you hear me?
Yes, I can.
Okay, I'm in my pajamas, so I don't want to be on camera.
There's no camera, actually, just on me.
Oh, good, okay.
So Kathy found me through the toddler course, right?
Yes.
You are an SLP.
Yes.
And
I did the early learner course, and I've done I'm doing the bundle, or I've done the bundle class.
And,
but I really liked your ethics course a lot, and I'm sorry I missed the first part of this, but your first speaker was I can't remember her name right now, but I really
Schwartz, yeah.
I really liked I'm sorry to go back on this, but I really liked what she said about ethics not being like so much what's right or wrong, but being able to talk about it with everyone, and there's no real right or wrong answer. I like that about ABA too, that they're looking for it. Mm-hmm. You're looking for what's right, and it's not always black and white. So I really appreciated what she had to say about that.
Right. So Kathy is an SLP, but she took the toddler course and she works in early intervention. And after the toddler course, she joined the bundle basically, and now you're pursuing your ABA coursework, right?
Well, I have started my ABA coursework, but I'm not sure I'm going to go all the way with it. I'm actually doing some tech work. I took the tech training so that I could really, because my passion is to really work directly with the kids. And so I'm learning a lot right now from the supervisors in the agency where I'm working. Cool. So I'm doing that part-time along with my speech therapy. So I'm not sure whether I'll continue. It's just a lot.
Yeah.
That's why I've been missing out on your course, and you're my favorite ABA.
Oh, thank you. Yeah. So did you watch the whole ethical series then?
Yes, I love the ethical series.
Yeah. Yeah. So we just went through each of the speakers and kind of, some of my philosophies. And I'm sure, you being in the early intervention field for a while, I'm not sure how many years, but you did get
more than 20. So.
Okay, 20 years.
Yeah.
Then, you really came to learn about ABA through me.
Yes.
I think you had some preconceived ideas about what ABA was because you had seen some not so good stuff, right?
Well, the way I got so interested in ABA was when I would go to children's homes who had autism, I'd end up chasing them around the room. And when I went to an ABA session of one of my kids, I saw them actually sitting at a table and communicating. And I thought, I have to learn this because this is really, really something that's important to be able to get their attention enough to be able to communicate. So I really do believe in that great behavior approach. And then I found you, and you are so good with toddlers. And I've shared a lot of my information with my team, my early on team, that they found very valuable too. So
Good.
The only thing I wonder about ethical, when we're speaking about ethics, I just talked to a mom today who's so concerned that the ABA therapist is going to come in and practically take over her home for like hours and hours during the week. And she's just so overwhelmed with that idea. And I just wondered what you thought about that too, ethically, to have an ABA therapist in your home for 5 hours a day, maybe 3 or 4 times a week.
Yeah. Well, we did 40 hours a week. So
in home
hours for 5 days. Yeah.
Huh.
For a few years, we did the whole Lovas thing, and then we moved to BB. So, luckily at that point, the recommendation by the behavior analyst, there was no such thing as behavior analyst back then. So, but the behavior Lovas replication site person was for Lucas and the therapist to go in the basement and for us to have a camera that we could view at any point to make sure that everything was cool. So they were kind of in the basement, and then I was upstairs with Spencer, but I'd have to either be there or get another person to come over to, like, even if I took Spencer with me, I couldn't leave because the therapist was being paid by medical assistants. They couldn't be, so I'd have my dad come over and sit there. He's like, it's like you're on house arrest.
Yes. But you thought that was important to do that.
Well, to get out, to be able to get out, I had to have somebody come and sit there. But, in the end, and I don't know. I don't think anybody really needs 40 hours a week. Like, I think the better approach isn't for the kid to be quarantined in the basement working with a therapist. I think to have the parent learn, the parent, hire people to not have them in the basement isolated. Because, like, what I find is, like, even for speech therapy, okay, these are people that posted in my group over the, months or years. I'm driving my kid 70 miles one way to speech therapy, and the speech therapist is having me sit in the waiting room. It's like, the mom should be there. They should be watching.
Yes.
Well, the 2-year-old is screaming when the speech therapist takes it. That's a problem. Okay, so now all the stuff they learned from me about pairing and getting, now that's off. And then I wouldn't let my non-vocal kid go anywhere with anybody. Because you don't know. I mean, you don't know if they're abusing them. You don't know what they're doing. And, especially if you're willing to learn and do some of the work. So it is, my house has been for 20 years, Grand Central Station. I mean, Many, many people know the code to my door. I've had, 11 years of au pairs so that I could do stuff and still have therapy for Lucas.
Mm-hmm.
So it is a very different life. And I mean, I can relate to that mom's concern. And there's, like, I'm not like a super private person and super, fussy. And so I imagine if you are, or you have anxiety, or you have whatever going on, it is a big adjustment. I mean, maybe for her, you could, maybe they could ramp it up so she's more comfortable. I mean, maybe she's just anxious because she doesn't know these people. I mean, having strangers in your home is, like, I don't know how old her child is, but like, I would encourage her to take my toddler course. You know what I mean? Because then she could learn what the therapist is supposed to be doing. And then she could learn how to advocate and learn what she's supposed to know, because nobody teaches the parents how to advocate.
Even when you had someone in your home, they weren't teaching you.
No, I mean, because the person that's coming in the home has no idea what they're doing. So, the people that were coming into my house, I mean, they were learning from this person that would come in once a month. So we all knew kind of nothing. But if you take my courses, you'll at least know the basics, and you can start to have discussions about, like, if this clinic is using the BB map, is the clinic or the school going to be doing escape extinction? I remember looking at a school one time for Lucas, and he was getting evaluated there to possibly go there when he was going to go to kindergarten, and my public school district didn't have a lot of good options. So they're like, go check out this school, we'll get you an assessment or whatever. So one of his therapists was with me, and so we're all meeting, and Lucas is like sitting on my lap or something, he's like, no, he wasn't sitting on my lap. He was 5 or 6. He was sitting in a chair next to me. And they're like, okay, we're going to take Lucas to the other room to do the evaluation. And his therapist was going to go with him. They didn't want me to go, which was fine. But they go, now, if Lucas doesn't go readily, can we do like a 2-person lift or what? I'm like,
oh my gosh.
You know what I mean? Like, they're asking me if they can restrain my child. I'm like, no, we have corn chips. He'll go. Like,
Right.
Wow.
And then, it's just like crazy. It's like, oh my God,
So, Mary, can I jump in here too with this conversation? One of the things, as someone who's been working in the homes for just about, I worked in the home under early intervention Part C in New Jersey, and then after I got my BCBA for an extra year and a half, I was working in the homes creating, in-home programming. And one of the things Alicia said to me was, she said, we're like, we just move in. And I coined that line. So for that mom, Catherine, that you were speaking of, I would confirm that for her. And what I have done in the past, and it's actually kind of held my feet to the ground with families who have said that to me, is, you can't do a serious, it's not even worthwhile if you're going to try and do less than 10 hours, because we could actually make situations even more complicated for you. But if you do at least 10 hours, hopefully you're going to go for 20 hours. And after we, quote, move in, give it a month or two. And if it's still a problem, then we can always stop. You can always decline services. But I have more than not found families, actually in every case, wanting more services. So
that's good to know.
Really,
I could tell her that at least to try it, right?
Yes, because I've had more families say to me, I wish I didn't wait so long, or I wish that I had tried this sooner. And as one of those moms, I was that mom. I was told to get a behavior analyst for my daughter, and I put, my nose up in the air. She's 21 now, almost 22. And I'm gonna take care of this myself. And again, ABA is certainly in my part of the world in New Jersey, Pennsylvania, was still in its infancy. And but it also meant a huge commitment in time to find the strategies that are going to work. And I really wish I had gotten more involved in the ABA programming. It's overwhelming for moms to raise a child with any disability and try and keep the script that they had in their head of what the family life was going to look like. It's very stressful. It's not like a game of fish, right? So where you give one card and you get back something else, oh, okay, I have this problem, so I'll just hand back another problem. It doesn't work that way. So I think it's very well founded for these families to have serious concerns about bringing a troop of people traipsing through their home. I totally get that for them.
Right.
But
I think if you compare it to other disorders, like if he had cancer and you needed chemotherapy, yes, it's going to be disruptive. It's going to be horrible.
Yep.
But you're going to have to do it. And it's like better to do it now while their brain is very plastic and you can make the most gains. And you
Correct.
really just have to turn up the burners. I would really, Kathy, send everybody that has any problems to marybarbera.com/join and get them into my world, and I'll start talking to them. But I do want to mute you guys just because I want to tell you a couple more things. I really appreciated everybody's coming tonight to hear about the ethics discussion. And I know we kind of have a mixed group. We have got some people that are already deeply entrenched in my world through the verbal behavior bundle, which we sold for the very first time in March. So those people are coming to the end of their 6 months probably. So if you are here and you are in that camp, we do want to continue having you come on the journey with us. Make sure you stay on for monthly membership, and then you don't lose any of the resources. You have 25 bonus videos, you have the early learner course, the intermediate learner course, you have the Facebook group. So we do want you to stay. And for those of you that just kind of dipped your toe in the water, listen to the ethical series. We do want you to consider joining us in the verbal behavior bundle, which you could get all your credits and you could get a lot of information about the early learner and the intermediate learner course. If you are really unsure and you want to listen to a free workshop, I did a really good workshop on the 3 big mistakes autism professionals make with intermediate learners. It got really good reviews. That is available for free on your own time frame. That is at marybarbera.com/intermediate workshop. If you know you want to jump into the bundle, Kara will post the link. And Lynn is also talking about trying to get her group to do a group rate for the bundle. We can give group rates for any of our courses, the toddler course or the bundle, for groups of 5 or more. And if we get a really big group, we can give even a better discount. So if you're thinking about it, if you have any questions, you don't know when your date's up, or I think I saw somebody in the chat who said they had technical problems and they bought the ethical series, but they weren't able to watch it. Anything like that, just email us at info@marybarbera.com. This is not about making another sale. This is really about making sure that you get the information you need, you get your certificate if you need it, and we start really helping to not just turn individual clients around, but turn systems around and turn organizations around, so that we teach kids the most ethically we can, the safest and the most efficient ways we can, so that we can really make them as independent, as happy, and as safe as possible. And that's my goal for every child, whether they have autism or special needs or whether they're typically developing. So any final thoughts on that? Just unmute yourself and chime in. But I really do appreciate everybody coming and staying tonight for this really great ethics discussion.
Thank you, Mary.
Thank you so much for doing this for us. I really, really appreciate it. And I know my group does too. Thank you again.
Yeah, no, I appreciate you getting everybody together, Lynn, and I look forward to another group joining the bundle soon. And any other questions at any point, just info@marybarbera.com, and we will get you in the right place, making the best, best treatment for all of our kids. Have a great night, guys, and I will talk to you all soon.